This is a completely other system that needs a lot more vitamin D. Vitamin D will inhibit the growth of fibroids. Number two, vitamin D also helps regulate other growth factors as well. And since we're dealing with a fibroid, we're really dealing with something that's out of control as far as the growth. Vitamin D also is an aromatase inhibitor. It blocks that enzyme, preventing excess amount of estrogen. Vitamin D increases apoptosis, which causes the fibroid cells to commit suicide, preventing the growth of a fibroid. Vitamin D downgrades estrogen. And also vitamin D helps to increase this certain hormone in the liver to help lower the amount of free estrogen that's throughout the body. So if we look at this whole situation, estrogen is the primary driver, but we don't have the brake pads, and that is the vitamin D. They're going to get more fibroids than people that have enough vitamin D. Now, let's take a look at obesity, for example. Obese people are always deficient in vitamin D because vitamin D gets diluted into the fat cells. So an overweight person needs a lot more vitamin D because it gets diluted and it's less effective. Now, as far as type 2 diabetes, there's always low vitamin D. High blood pressure, I think the majority of that is low vitamin D. That's really behind high blood pressure. Because if you give a person more vitamin D, their blood pressure goes down. Right? And then, of course, you have polycystic ovarian syndrome. That's a situation where we have way too much insulin.